Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner and my very Bobby co-host. I don't know why you do that. You sit there not moving until I start talking, and then you start bobbing like crazy.
Because I'm feeling what you're saying.
Okay. This is Dr. Jason Martin. He's a board-certified bobbing plastic surgeon. Dr. Martin.
Just nodding with approval, you know?
Okay. Oh, no.
Ready to go.
Yeah, amped up.
Like Beavis and Butthead style.
Amped up. Well, it is exciting because we have the first part of a two-parter listener questions and comments. We had some really good ones. Some of these I've been holding off on for a little while. So the thing about these episodes is it always leads to more questions and comments, but then it's like a couple of months again that there's a little bit of a delay. So I do always tell people when I'm answering your questions, but just know if you left a question toward the end of 2025, it's probably being answered now in February.
It's fun to see the comments with the replies and the comments to the comments replies, and then it kind of goes deeper. So we're getting a lot more of those lately where people, there was an episode recently where I saw comments of people just talking about their experience doing surgery. So it became more about them talking to each other.
Yeah, which is really cool.
Yeah.
So before we get into this episode, if you'd like to follow us on any social media, you can find all of our social media handles here. We're at Beauty and the Surgeon Podcast and at Jason Martin MD. You can also, if you want to be featured on an episode of listener questions and comments,
are they going to come into the studio with us? Is that what you're saying?
You can leave a comment in the section below, or you can send me a voicemail, leave me a text, 303-630-9038. We had 2 texts this time, Nils? Were there 2 texts or 1 text? I can't remember.
I think there are 2.
There's 2 texts. No voicemails, though.
Come on.
Which is always
I love the
bummer.
voicemails.
Yeah. So, Dr. Martin, without further ado, should we jump into the first one?
Let's go. Number 1.
All right. So the first one is a text. This was an email. Oh, this was from Wesley. Yep. And this was a 2-part email from Wesley. A little bit longer, but I'm going to read the whole thing. 35-year-old male, 6 days out from a tummy tuck surgery with liposuction and a hip lipectomy, possible muscle repair. I have found a highly recommended board-certified plastic surgeon here in North Carolina who I trust. My reason for this email, I've just finished listening to both supplement episodes, the one supplement around surgery, and left feeling a little confused. I'm planning to start taking some of the recommendations you mentioned. So far, I've ordered the liposomal vitamin C. Which other supplements do you recommend for me? Would love to know your thoughts on the below, which I've taken from both episodes. Thank you so much. Feel free to reach out or feel free to read out on a future podcast. So he's taking MK7, vitamin D liquid, which he rubs over his teeth, which is how I recommend doing it. Vitamin C twice a day on an empty, or bromelain on an empty stomach, 3 times a day. Zinc Supreme, which I love, and a chewable V vitamin complex. He forgot to mention, he sent me a second email that he also takes a multivitamin, magnesium glycinate, and a probiotic. My surgeon did tell me to stop taking cod liver oil.
Because your surgeon's smart.
Yes. So this was a great email, and I responded to Wesley that everything he was taking is absolutely what I would recommend. He did a great job kind of piecing things together from the 2 episodes, specifically the things that we talked about in that episode. The Zinc Supreme and the B vitamins are so important for just tissue recovery and healing in general, and for energy after surgery. I mean, I think B12 is one of the things that people don't really think a lot about because it's fortified in a lot of things, like cereals are fortified with B vitamins. So I think we all think that we're getting enough B vitamin, but you have to think of surgery as a really stressful time for your body, and it's going to be depleted really quickly, and you can't store it. It's a water soluble vitamin.
Yeah. B12 itself, the injections tend to make people just feel better.
Yeah.
So there's that secondary benefit of that too. But yeah, for sure.
Yeah. And this
guy's like way ahead. Wesley is a savant when it comes to this stuff. He really.
Well, he listened to some podcasts from This is how he got this information.
Where do you think he got all that good information?
Yeah. The liposomal vitamin C, I really love, especially for that first week after surgery, because it's just so much more bioavailable. And this is really key, again, with your water soluble vitamins. So vitamin C is another water soluble vitamin that is also going to be depleted really rapidly when you're under stress or when your body needs it for recovery. Dr. Martin, what is one of the main things that collagen needs?
Vitamin C.
Vitamin C. Yeah. Collagen needs vitamin C.
That's the example we always give of scurvy, the deficiency of vitamin C. You can't heal your wounds.
Yeah.
And so you run through that quickly after surgery, and especially, usually after surgery, tummy tuck, you're not eating as well. You're not getting your calories in. So supplementing before and afterwards is really smart. Amy, can you go into liposomal vitamin C? So I know liposomal approaches because of, some of the local anesthetics we inject, but can you explain what that means, liposomal? Is that just stabilizing the vitamin C compound or vitamin because of the effect that sun and other things has on it? Is that what that is for?
What's the delivery method?
Yeah.
So if you think of something like a vitamin C caplet, let's say it's a compressed tablet, that has to go through all of your digestion. and hopefully is broken down efficiently. So let's say that you hopefully have enough of the right stomach acid to actually break down this tablet or this capsule, that you have a transit time that allows it then to be actually absorbed. You're counting on a lot of things. So like, let's say you take 1,000 milligrams of vitamin C and you actually only absorb 200 of it.
Yeah, which I did last night. I took a vitamin C tablet. I forget the other thing, compounds in it. You bought it, so you probably know more than me. Like rosebush, I don't know, something along that line.
Probably not rosebush. That's probably not what it was.
No, I'm joking. But yeah, I did take the vitamin C, but it was in a tablet form. It wasn't liposomal.
Yeah, so the benefit of doing something in a liposomal is that you're going to have a more direct absorption of it. So specifically like a vitamin C, it's very, with our water soluble vitamins, some of them are more bioavailable when they are in a fat or with a fat substance. So liposomal just means it's in a kind of fatty base. They're typically liquids that you take, which is how I would prefer. I think it's funny when you have a liposomal that's then in a capsule, because like there you are again, like then you have to, break down the capsule, and anybody who has a rapid transit time, meaning the time it takes from the time you swallow it till the time it comes out, has potentially maybe even seen like full capsules in their stool.
Yeah, that's so interesting.
So for when you really need it to count, you want to make sure you're absorbing as much as possible. A liquid liposomal is key. And that's also why I like liquid vitamin D for that same reason. And rubbing it over your teeth is because calcium and vitamin D work very closely together. So you're actually going to absorb it more through your teeth and in through your mucous membranes of your mouth than you would if you were taking a tablet. Which is also why the dosing can be lower. So people see like an oral and they're like, oh, well, it's only 2,000. I'm going to take this 10,000 IU capsule and it's going to be better. Well, you're probably not going to absorb much of it.
Yeah.
So... yeah.
Liposomal local anesthesia, what we've talked about before, is called Exparil. We use that a lot with tummy tucks, actually. You might have had Exparil. And that all that is bupivacaine, which is a longer acting local that's surrounded by this kind of fatty ring. And it preserves the local for longer. So it'll kind of break down over time and release it over time. So it's very interesting.
Slows it down in the tissue. Yeah.
So interesting. Oh, I love this question.
Yeah. So Wesley, you listened to the episodes and you picked the very perfect combination of everything. And yes,
hopefully, Wesley, you weren't having to take the cod liver oil raw like Amy made Nils and I do. What episode was that, Nils?
That was stuff we're into from a few years ago.
A little while back.
Yeah.
It's a reoccurring joke that we got. Why would he have to stop taking that?
It makes you oozy. Yeah, it's fish oil.
Increases your tendency to bleed.
Good to know.
Yep. So you're just going to stop that around the time of surgery. All right. So this next one was a text and there was no name. So I'm sorry, no name. You did not text me your name. So here's the text. I have lost over 100 pounds and kept it off for 1.5 years. Last January, my local plastic surgeon, Amarillo, I had my arms done and the tummy in May. All is looking and feeling great. I spoke to my plastic surgeon about having my legs done. She said we could do my thighs, but that my calves aren't an area of great success. I'm afraid my legs will look strange with such large calves compared to my thighs after thigh-plasty. Do you have success with calves?
Okay, is this question related to like lifting the calves or debulking the calves?
And this is the whole text. So this we have to infer this ourselves. But she does say that she has large calves.
Okay, so for sure, lifting the calves would be difficult, but for sure, debulking the calves is definitely a possibility. Now, I'm not looking at you, and I have to defer to hopefully a board-certified plastic surgeon in Amarillo who's seeing you. But we do calf liposuction more than we do it on a regular basis, and it works really well. Now, you're not going to be able to bulk it maybe to as much as you want. If you're naturally born with large calves and you have a fat distribution there, it's not going to go from very large calves to small, normal calves. But you can reduce it down, in some cases 30%, 35, 40% in volume, which is a big change. And definitely I would consider doing that if you're doing a body lift or a thigh lift, also doing the calf liposuction. At the same time or afterwards?
Yeah. And what I would say is look at your arms. You had the brachioplasty done and
then your forearms.
Right.
That's a good point.
It's kind of the same idea.
Yeah.
And as much as we would all like to believe that we will somehow have like the stick skinny legs of a supermodel after a thigh lift, that's not realistic. Or arms like you saw with your brachioplasty. So it's kind of that same idea. Like, you don't want to your surgeon would never be able to anatomically pull your upper legs so tight that your calves looked really big by default unless they were already so aproportional to begin with.
That's a really good point.
So
the thigh lifts or the body lifts never pull as much as you want it, but they do make a big change. We do those a lot too, and the patients are really happy. But there is a limit to how much you can pull. And so the idea that you're going to have this huge asymmetry contour-wise from the upper leg to the lower leg is pretty unlikely. Also, we get people in here who have, I mean, God bless you for losing 100 pounds. It's amazing. Who haven't lost 100 pounds. They are of normal BMI or normal weight.
Just have big calves.
Big calves,
Yeah.
and they look totally fine, even though it's disproportionate from the upper leg. Actually, when you look at them, you don't get this feeling of wow.
No, but those are the people who make great candidates for calf liposuction.
Yeah.
I mean, we have had a couple of patients who, you know, you don't think of it when you look at them, but then when they actually show their calves to us, it's kind of like, oh yeah, there is a disproportionate calf there.
Yeah, and they're the ones that, actually calf liposuction is more patient driven.
Yeah.
It's not like I usually look at people and say, I want to liposuction their calves. They're like, they'll say to me, I don't really like my calves. They're probably the same way you feel.
Well, or I can't buy boots or even like leggings or jeans are challenging because they're disproportionately large compared to their thigh.
Yeah. A couple things on calf liposuction. You definitely have to go to an expert for that. Calf liposuction is one of the hardest areas to liposuction. So we do it a lot, but not everyone that does liposuction does liposuction of the calf. So the couple hard areas of liposuction are the arms and the calves. And I would say the calves are harder than the arms.
For sure.
Secondly, you cannot overly deplete the calves because then you'll trade one problem for the other. You don't want to have saggy skin on the calves.
Or on the, like a pool around your ankles.
Ankles are even harder.
Yeah.
So ankles, if we're talking about the ankles, those are even harder, which those are liposuctionable. The hardest place to liposuction actually is the face. There was a period of time where people were over-injecting fat transfer to the face, and liposuction in the area can be very, very difficult. So, you know, the calves are on a scale of 1 to 10 of difficulty, an 8 or a 9. So you have to go to someone who's comfortable with liposuctioning of the calves. And if your surgeon who you really like, who's doing a great job, maybe just do the thigh lift and see how your calves look. If you think you need it afterwards, then you go to someone who specializes in that.
Well, her surgeon might. I just say, just
maybe
talk
go back
to her
and
about
talk to her again.
Yeah. But either way, think of your arms, and it's kind of the same idea with the legs for most people.
Yeah.
All right. So now we have a YouTube comment. This person did say English is not their first language. And this was on our video, is a deep plane facelift superior to a SMAS facelift. This was a short video. Thank you. You say you have to treat the foundation. What does it mean? Is it a layer or what? Or the surgeon will know whether a SMAS or a deep plane is best for you.
Yeah, it is a layer.
Yeah, that was such a great question. Like, what is the foundation? Because we do say that in that video. Like,
right.
But it's a good question. What is the foundation?
Yeah, and I've been updating the blog articles on our Facebook page. So hopefully when this comes out, everything will be updated.
On our Facebook page?
All right, whatever, the website.
Like, people still use Facebook?
Oh, that's right. Did I say Facebook?
You said Facebook.
Oh,
I'm
I
like,
meant facelift.
I'm like, no one uses Facebook.
Oh, that is so funny. That is so funny.
I literally haven't used Facebook since like 2014.
That's a very good. When's the last time you've been on Facebook?
It's been more than a decade.
I have never been on Facebook.
Exactly.
I never made an account.
Yeah.
Ever.
Awesome.
So I'm one of a very unicorn in that.
Yeah.
Yeah. I couldn't use my Oculus for a long time, my little VR, because they wanted me to have, they're like, use your Facebook. And I'm like, I don't got one.
Yeah.
You
Who
know?
does Facebook? Yeah. Nobody does Facebook.
They had to make like Oculus accounts for people who didn't have Facebook accounts.
That's pretty funny.
Zuckerberg just really wanted everybody on
That's his whole
Facebook.
thing.
So yeah.
Yeah, I haven't been on Facebook in a long time. Our facelift page on jasonmartinmd.com. So hopefully by the time this comes out, that will be updated. I'll have a lot of blog articles on there. And one of the big topics that I've been writing about for those articles, because I personally like to write those articles, is about the deep plane, about the SMAS, about this layer of foundation. And I have to tell you, it's kind of hard sometimes to figure out analogies to do that.
Well, I mean, it's saying it's the muscles underneath. That's really what it is. It's the muscles. It's the tissue. It's,
with
it's what's under the skin.
With a fascial layer over that. And that fascial layer really is the SMAS.
Yeah.
SMAS stands for something. We don't have to go in through that. But it is a layer underneath your skin and underneath the soft tissue, which is basically fat. Is a layer of muscle and fascia, which is the foundation. And just like your skin and just like the fat, it loosens and drops with age.
And atrophies and wastes, does all those things
Everything that happens
do.
with age, yeah.
Yeah,
so,
unfortunately, gravity.
So the idea, again, we've said this 1,000 times, but if you just pull the skin, and as you age, Amy's not aging, but I'm aging, you can kind of tell the areas that when you pull the skin that look better. If you just pulled the skin, the number one, the surgery won't last, and secondly, you probably look abnormal. Not everyone, but people that have researched facelift results and seen things that look weird, usually the skin pulled too tight. And the way you get around that is you treat this foundation layer, this layer of muscle and fascia underneath your skin and soft tissue, and you lift it back up. You can lift it with something called a deep plane. You can lift it with application techniques called a SMAS plication or a SMAS flap that lifts it and plicates it or sutures it in. All of those techniques, per the data, show similar results. All of those techniques are what give longevity to a face and neck lift and also allow you to not pull the skin too tight but still look rejuvenated. Is there a better way I can say that?
Nope. I think that was perfect. It's like recovering a couch cushion.
Yeah.
It's the foam underneath. If you don't fix the foam underneath your couch cushion, you just put new fabric on it, it's not going to look good.
It was funny. I did feed it into AI, just trying not to use AI's result, but trying to think of different ways. You know, that I think AI is good like that because it makes you think of different ways to say things. And the thing that came back was, it's like wallpaper, and then wallpaper's put over the scaffolding of a wall. Okay, but it's like, just imagine the scaffolding of the wall is droopy, and I'm like, well, then the whole house would fall down.
Yeah,
you know,
You lean against the wall, you just go right through it. Yeah,
right. The idea, I mean, what they're saying is the idea of pulling the wallpaper doesn't give strength, but straightening that wall back up, reinforcing that scaffolding does.
Yeah. All right, that was pretty good. So thank you, Caring Coaching. That was a great question.
Yeah, and I think you did well with English in that text or comment.
I would not have guessed. Trust me, some of the comments I get, I don't know what language
What was
they're
the
speaking.
poetry one about a thigh? What was that one? Do you remember
One
that?
leg is bigger than the other from poetry.
Yes, it was like a haiku that we got.
And it was on an arm video.
Yes.
So yeah, it made doubly more no sense. All right. Next one was from this guy here, 71, and this was on Everything You Need to Know About Liposuction Part 2. About 2 weeks ago, I had minor lipo under my armpits, chest to lats. I'm looking at everything, and it seems nearly identical to what it was previously.
Oh, yeah, every time.
My bruising is dissipating quickly from purple into a yellow, spreading throughout. The static pin and needle-like tickling is subsiding, but it was not fun.
Yeah.
So I responded to this, but what do you think I would have said to someone who said, like, because now you don't really look at some of these things until you've had surgery, and then you can't stop staring at them, and you stare at them all day long, every day.
Right.
And it's all you look at, and it's all you see. And the changes day to day are very subtle, especially in the beginning. And initially, and we tell patients this, initially right after lipo, you're gonna be swollen. So you might even look bigger, like your clothes might feel tighter right after lipo because of swelling. And you're still bruised, so you're definitely still swollen. You're gonna be swollen for weeks. But
I mean, that's not just lipo. That could be true for tummy tucks and other things like that.
It's just true for surgery. Any surgery. I mean, even like a rhinoplasty, like people then, I mean, they already were staring at their nose and now they're staring at it even more.
Right.
You know, it's just to give it some time. Changes don't happen day to day. They happen over the weeks after surgery, and you just got to give it some time.
Yeah.
But yeah, the static pin and needle like tickling. Yep. And that's why I tell people like pins and needles or like zingers. Static is a good way to describe
Swelling. Everything
static.
Everything that this guy here, 71, noted is like universal. Mm-hmm. In 2 weeks, I mean, the worst swelling is probably 3 to 4 weeks. So he's probably not even into the.
Well, because then then you feel like the swelling should be gone and it isn't.
Right.
Because then you're feeling pretty good. You're like, well, now I feel pretty good. Like, why am I still swollen?
These are really good episodes. I mean, for liposuction, you got to wait almost 6 months to really feel like you can look at results. That's why actually photographs are so important for what we do. Mm-hmm. When people are like 2 months out and they're like pulling their hair out and like, why did I do this? And they're kind of misty eyed. You're like, look at these photos. And like, holy shit, I didn't remember I looked like that. So it's really hard to judge yourself day to day. It's actually very easy for me. I'll see people in these small intervals, like 2 weeks apart or 2 months apart. And I'm like, wow, you look so much better. And like, oh, I do. And because I can tell, because I haven't seen them every day. It's hard to tell that incremental change.
Well, and also this is true of other surgeries like a facelift. People are like, well, people think I look the same. I'm like, well, because you look like yourself.
Yeah.
You know, like, yes, like, yeah. You know, there's sometimes when like the best surgery is the one that no one notices because you look normal.
Yeah.
You know, but with something like lipo, it just is. It's the long game. Yeah. You know, it's like I think I say in that episode, like life goes on after lipo. It just goes on slowly. Yeah. And that includes the recovery.
Yeah. It's long-term investing with lipo. You don't get it's not Bitcoin. Mm-hmm. You don't get a quick return.
It's not instant.
Yeah.
But it'll be worth it. So hopefully this guy here, 71, now that you're more than 2 weeks past, you're starting to see the benefit. And
I would like, if I knew this guy, I would like think it'd be hilarious if he introduced himself. Like, I'm this guy here, 71. You know, it's like very funny. These names just crack me up. Like, how did he come up with that?
Hey, at least it's not just random numbers.
Yeah,
so I appreciate that. Yeah. All right. Next one was also on the same episode, Everything You Need to Know About Liposuction Part 2 from Lee Anneman 2181. Thank you for sharing. Are you able to provide any tips about getting through those first difficult weeks?
I mean, just a crap load of Norco, right, Amy? Opioids, tons of opioids.
Actually, you know what I would recommend is listening to our episode about Reddit response, the liposuction one, and that made one of my top clips of the year for 2025, talking about like how to prepare for lipo. You know, really, it's not even difficult the first weeks. It's really the first week. And what I tell people is just be prepared. Like I just said, life goes on. It just goes on slowly. Like you're going to be the turtle. Like everything will get done. Like you'll get dressed, you'll take a shower, you'll do things. They'll just be slow and slow to get going. But once you're up, you're good. Like once you're standing, you're good. Once you're sitting, you're good. The in-between is what's tough. But more than anything, just knowing that and knowing that it's going to get better every day is the biggest thing. Like just reminding yourself like, yeah, this sucks, but it's getting better every day. And the first week is going to be hard.
Yeah. And like the key thing that Amy said there was walking. And that's why we try to get people, all joking aside, off the opioids quickly. So because when you're on opioids, you have a tendency to want to sleep and just lay there. And that's the worst thing you can do for liposuction. Walking stimulates the blood flow, stimulates the lymphatics, and really starts to make you heal faster. Mm-hmm. It's medicinal. And it's hard when you're all, doped up on opioids to be able to walk on a consistent basis. Also, sometimes it can be unsafe. You're unsteady on your feet. So we definitely encourage people to mobilize as a means of healing faster. But yeah, I agree with Amy. Amy is the one, she's the recovery expert, but outside looking in, I mean, it seems like the first week is the hard week. Yeah. And then after that, people are pretty good. I mean, they'll come back in a couple weeks later and be like, man, that was something. But they're not like, oh my God, this is the worst pain I've ever had a couple weeks out.
Well, but it might be. I mean, this is the thing. Like, and this is why that episode is so helpful because, I have a slide that says, lipo hurts. And then the next slide is, well, sometimes it doesn't. Pain is very subjective. So I think it's very often that people say, wow, that wasn't as bad as I expected. And I'm like, yeah, like you made it. Like when I'm talking to them the next day, I'm like, you made it through the hard part. Like it's not going to get any worse than this. It's not going to get a lot better than this for a while. Like you're not going to feel a lot better than you feel right now for like a week, but you're also not going to feel any worse. And then there's other people who, like say it was like the worst thing ever. And like they're in so much pain. I'm like, yeah, it'll get better, Yeah. Like it just, it sometimes it hurts. Sometimes it doesn't. Be prepared for leaking like a juice box. Nels, what were you going to say?
I was just going to say that we have lots of episodes on liposuction from myths and all this stuff, and all of them have something about recovery. So do we have a playlist that's all lipo?
If we don't, I'll make one.
If we don't, we should definitely make one because I mean, even if you just jump ahead and look at the recovery spot or the preparation recovery, we have probably a couple hours just on that alone.
Well, because that's a lot.
Yeah. And our comment section, people were going through it too. So maybe that can help.
It's one of the most common surgeries done in plastic surgery. Yeah. I mean, that's one of the reasons we did that because it's ubiquitous. Everyone, it's everywhere. Everyone does it. So.
Well, there's a lot of myths about it.
There's so many myths.
Yeah. But either way, Leanneman, you will get through it. Just know you'll get through it. That's really more than anything. Just know that you'll get through it. Yeah. All right. So also on the same episode from Little Yellow Carrot. I love this. I see some of the names are great. Little Yellow Carrot 1571. I'm so grateful for this video. I'm just 1 week post lipo and I found all answers to my many questions. Thank you so much.
Awesome.
Yay. Thank you. And like Little Yellow Carrot. I loved it. And this was perfect timing because I think this comment came in the same day I sent the slides to Sarah. So nice. Good timing. And thank you for watching. And I'm glad it was helpful. So see, like Nils said, we have lots of helpful content on lipo. All right. We're going to take a quick break. We're going to come back with some more questions. And we're back. All right. So this one was from our Reddit response tummy tucks.
Not weird Reddit, normal Reddit. Yes.
This is from Daisy. How long should hunching be? I have not had surgery yet, but I'm trying to get a better idea of what to expect and what's normal and what's not. So we have a great, as Nils has just commented, we have some great videos just about tummy tucks. And in there, we talk about having, in the part 2 is when we talk about recovery. So everything you need to know about tummy tucks, part 2, we talk specifically about what to expect week by week. And we do say that you'll, have a slight curvature. Hunching is maybe a word too strong.
Yeah, I think that's a little too strong. I mean, we're aggressive with tummy tucks. Yeah. I just want to make this really clear. I mean, you could do a tummy tuck and not pull tight. But we pull very tight. We want to give people their money's worth, and we tighten the muscles as much as I physically can. So it's not like we're not aggressive. And I still see our patients able to stand up somewhat upright, somewhat.
Yeah. And that's what I tell our patients, because this is a very common question. They always say like, well, how straight can I be? Because some patients come in and they're like, they're really acting very protected. And they ask that. And I say, well, how straight do you feel like you could be? And they're like, this feels fine. And they're completely upright, pretty much. Like, if that feels okay and you're not pulling, you're fine. Yeah. And that's that
feedback is important.
Yeah. So, I mean, being protective of the area is good, but you don't need to be overly protective of the area. And that'll ultimately can add to other problems.
Oh, referred problems.
Yeah.
Your lower back, your upper back, your cervical neck, your spine.
Everything can start hurting if you're walking
shoulders. I mean, you see it all the time. If you walk in an inappropriate physiologic position, it only takes a matter of hours and you're really going to feel it across the board. And everyone knows that, because if you've ever injured anything on your lower extremities and walked funny, inevitably something else starts hurting. Yeah. And that's just all the same. So it's all interconnected. We don't tell people to hunch over. Some doctors may do that, and I'm not saying that's wrong, but I think if you tell people to do something, people are really wanting to do the right thing and they'll do it to the extreme. So the better way to say it is exactly how Amy said it. When you start to feel things pull and start to feel discomfort, you stop that and you alleviate it in whatever position you can. Also, if you're walking over hunched over, you're going to be less likely just to walk in general, because it's really hard to walk like that. And then if you're walking less, you're going to be at higher risk for deep vein thrombosis and pulmonary embolus and infection and swelling and bad outcomes. Walking is medicinal. We said this before. It's therapeutic, especially after surgery. So you can't put people in a difficult position that they can't walk. I mean, it's really hard to walk like that.
Yeah. Yeah, it is. And that's what people say, like, well, I've been doing this, but it like really hurts. I'm like, yeah, don't do that.
Yeah.
Like, or, they'll read on, let's say Real Self, because man, the stuff that I hear from Real Self is unbelievable.
Do people still go on Real Self?
They do.
Right.
And they'll say like, well, how long do I need the walker for? Like I got a walker. I'm like, never. I'm like, if you need a walker to walk after surgery, we got to talk. Like something's not right. Like we need to talk about it. So you should not be in that kind of debilitatingness from a tummy tuck. Now, if you're having tons of other stuff done, that's different. But from just a tummy tuck, like you should not be needing that kind of assistance to just mobilize. And because again, if you're trying to use a walker and you're not needing a walker, you're not going to walk. You're going to be like going out to the mall, like with your walker when you're a 35-year-old woman. Like you're just not. Like then you're just not going to walk.
Your version that you're painting is cracking me up.
Yeah, well, it's true. I mean, like if you imagine us telling one of our patients, like, no, you need to use a walker, they'd be like, I'm not leaving my house like this.
Yeah.
Like, no.
I mean, I think that instead of a walker, walking with someone who could help you if you need help.
Yeah, walk with somebody. Don't walk with your 100-pound dog right after surgery.
Get that all the time.
Yep. Yeah. And just be cautious, and you will be. Trust me, you will intuitively know how much is too much with stretching your abdominal wall.
Yeah.
Do not force it in either direction is what I tell people.
A diastasis repair, rectus diastasis, we have tons of stuff on that. It's the stretching of the muscle usually happens with pregnancy or if you were overweight and then you lost weight. And bringing those muscles together, no matter what anyone tells you, we all do similar things, is using some sort of suturing technique. I use permanent sutures. Some people don't, but they're always thicker and they're aggressive. And you're bringing the muscles together in the midline, above and below your belly button. Hey, that hurts like hell. Every time you engage your core, you have sutures that are holding that muscle together, suture material.
And in a new position, like in a position it wasn't used to before surgery.
So, and also you find out quickly that it's almost impossible to move without engaging your core. So it's so funny. We all try to do sit-ups to make our core look better because we think our core is not getting engaged, but it actually is pretty much on a regular basis with any kind of movement.
Like walking.
Walking for sure. Laying to sitting, sitting to standing. So, but at least on my end, when I do the diastasis repair, I do a double repair. So when you start ripping things out, you're not going to destroy everything that's in there.
Yeah. No, and really after surgery, I tell people like, you're not going to hurt the surgery results before you hurt yourself. So if it hurts, stop that. There's like, I don't want to do anything to damage it. Like, then don't do anything that hurts you. If you're pushing past pain on anything, like, then you're pushing through something your body's telling you not to do.
It's not CrossFit.
Like, stop. Yeah. Yes. This is not CrossFit. No.
Wow, this hurts and my incision line is opening up. I should go further and faster.
Pushing. Yeah. This is fine. All right. So moving on to everything you need to know about breast augmentation part 2. This is from
when we do it?
Sterile Girl Celine.
Sterile Girl Celine. Sterile girl.
Sterile girl, Celine. Do you have a video on how you treat hypertrophic scars and keloids in your incisions after surgery, such as when you begin steroid shots and at what intervals? If/when do scar revisions and other methods you use to treat hypertrophic or keloids? And she said your podcast is absolutely stellar.
And we got 6 gold stars from Sterile
and
Girl.
a champion thing.
Yeah, and a champion emoji.
Yeah, she left a lot of stars, which is awesome.
6 is better than 5 for sure.
We do have an episode about scars.
This one right here.
Yep, all about scars.
All about scars.
Yes, and there is a big difference between hypertrophic and keloids. Just I want to put that out there up front. So keloids are relatively rare. If you keloid, you know you keloid, and it is very different than hypertrophic. What most people have, and we say this in the episode, is hypertrophic. Now, you can treat hypertrophic scars with steroids. Keloid, you can also treat with steroids. The interval question is a good one because I think there's probably 2 thoughts on this, Dr. Warren. Wouldn't you agree that there's doctors who would say start early to prevent it? And if you have a known history of keloiding, that's probably the answer.
Yeah, if you have a known history of keloiding, that's a totally different conversation than if you're just a person that doesn't have keloiding, but you have evidence of hypertrophic scarring. That's the confusing part because why would you start steroids, especially with the breast augmentation, if that's what we're talking about, which shouldn't have that problematic of a scar, which in almost all cases is along the inframammary fold. It can also go around the areola or the armpit. But whatever the case is, if you have keloiding, that's a different conversation. So if you're if you're a known keloider, then you would have a therapeutic plan with your surgeon for afterwards. You would start steroids early. You may consider different type of injections, and in rare cases, you would even do radiation treatment to the keloid. Okay.
Well, and scar compression too. I would have people start earlier.
Right, and scar compression and silicone sheeting, all these things are going to be helpful, but scar compression is very helpful. Yeah,
compression specifically. But it's interesting with ears are an area that tend to, people who keloid, who have their ears pierced, they actually make specific compression devices for that. To treat it specifically.
I just did this. So there was a young girl, she was 19, had pierced her ear, got keloiding on one ear, fair skinned. The other ear was totally normal. Okay, I'm not sure how that works.
It was a true keloid, not like a
It was
cyst?
a true keloid. No, so by definition, a keloid grows outside the area of the scar. So imagine almost like a cancerous growth. It flowers out. That is what a keloid is. And this is what she had. It wasn't a cyst. It was a true keloid.
Because you'd think with like a piercing, that irritation could cause a cyst to form.
But there was one side, and then afterwards I excised it, injected with steroid, and then had her wear one of those compression earrings.
Yeah, you have to.
But on one side.
No,
and she's like, well, it looks kind of weird. I'm like, well, wear it on the other. She goes,
put one on the other side.
She's like, it hurts. I don't want to wear the other one. Well, then look, rock star. You got one over here. Just walk around with one.
Yeah.
And she wasn't feeling it at all.
Well, they can get clear ones. Like they make them in clear plastic.
Okay, maybe we should have you talk to her because I was like, just go on Amazon.
No, you can get because we had that patient years ago in Aspen who had a much darker fit scale but had the terrible keloids, and she was young, and we had her wear them for quite a while.
It works though.
Compression
works.
Compression works.
But if you have hypertrophic scarring, I would wait and see and kind of where your scar is going to go.
Like a year.
Hypertrophic scarring, the scar is kind of can be a little bit raised, can be a little bit wormy and hard and annoying. Red. So steroid, which is Kenalog, which is what standard in the industry is what we use. You would inject that usually about 4 weeks apart, 3 different times. You could also do laser on that and, different things like that.
And the risk of doing too much, especially on a hypertrophic scar.
This is the key. If you start injecting steroid into scars, guess what steroids do? They limit healing.
Yeah, and break down soft tissue.
Right. So then your scars go from being thick and angry to widened and weird looking.
Yeah, think of like a really big stretch mark.
Yeah.
Is how it looks when you over treat a scar with Kenalog.
Definitely don't want someone to start going in Kenalog in there as like a prophylactic treatment of possible scars. Kenalog itself can cause loss of fat, which leads to a contour deformity, which you definitely don't want on your body or below an implant.
No, big divot.
So I think you just need to have a vigilant surgeon who is going to watch you. And if you start seeing evidence this thing's going to get kind of a little bit irritated and not appropriate, you can inject Kenalog pretty early.
If you have a known history of keloids.
Last thing I'll say, so people can have hypertrophic scarring in one area, not in another.
Mm-hmm. You can have keloids in one area, not another.
Yeah, we've seen, that was that lady. Yeah. So what you'll see along the inframammary fold or at the base of your breast is this right where the bra comes through. And when you start having a scar there and the bra is like irritating it, then you're causing like these micro injuries to the scar, and then they may fluff out and become hypertrophic. Just literally by means of way that bra kind of rubs against it and abrasion. So it's kind of a special area with breast augmentation. You obviously don't see that in the armpit as much if you're using that approach.
You certainly can. I mean, there can be lots of irritation in the armpit though. And the same thing, like, I mean, look at a patient who has like an anchor, a wide anchor scar from like a very big reduction.
Yeah.
That's an area that's actually usually where they have the most discomfort is up in the armpit.
I just had one of those, like it was a huge reduction. It was all the way over here. And that's the part became a little bit hypertrophic.
Exactly, because the constant movement.
Because it was her arm moving against it. And she even said that. That's
like
so
everything rubs it. Yeah.
Last thing I'll say. Everyone comes in, at least in the state of Colorado, after seeing an orthopedic surgeon for some orthopedic procedure. And they always tell me, look how bad my scars look. And I tell them I expect that because orthopedic surgeons absolutely do not care about your scars.
Oh, well, it's on a knee. It's on a mobile joint.
I know,
it's
but
not going to scar well.
If they close it, you're lucky. That's the way I look at this. So we're not comparing apples to apples there, right? Because plastic surgeons are going to close this meticulously. That's their whole job, is to make the scar look good. Whereas the orthopedic surgeons are just annoyed that they have to close your incision.
Well, or a dermatologist who just wants the cancer to be gone.
Yeah, they just want the cancer gone.
And you look like you were attacked by a shark.
Right.
Yeah.
So
different.
It is different.
Yeah, it's different. So watch that episode though about scars because it is a good one. And just know, I mean, especially if it's just hypertrophic, most doctors are probably going to want to wait to do anything on it for 6 months to a year because you don't want to. And we, in the scar episode, we'll explain why, because that scar is continuing to mature and change over the course of a year. I am a person whose scars stay red for an extremely long time. If I was to get upset about that, I would be upset all the time because if I even have like a little scrape, it's going to stay red for probably 6 months.
Yeah.
A scar is going to be even longer. So, but when they fade really well.
Yeah.
That's the benefit of being red. All right. Everything you need to know about lower body lifts, part 1. This is from Mrs. Julie Smith. She said, is a circular Fleur-de-Lis tummy tuck same thing as a body lift with a tummy tuck? The short answer is no. And Dr. Martin will explain the difference, but these are not the same.
Right.
A Fleur-de-Lis is a very specific thing.
Right. So a circular tummy tuck is not the same as a body lift. So you could have an extended...
Well, a Fleur-de-Lis tummy tuck.
No, just real quick. You could have an extended tummy tuck that goes almost all the way around your body. And that really goes from a tummy tuck into like what we would call a belt lipectomy. It takes the stuff around your flanks on the top of your butt around. But a true body lift picks up your butt. It literally picks up. It is meant to lift everything, which is different than just extending your tummy tuck around to your back. Now, a tummy tuck itself, which we have great episodes on tummy tuck, there's 1,000. Nils going to pick one.
We may have dinged that too many times. He might not be able to. Oh, that was 4. He's counting. Okay, good.
We have a tummy tuck playlist though too.
We do. We have a tummy tuck playlist.
I'll link to that. So
okay, I'll link to the tummy tuck playlist.
All the playlists.
Yep.
So yeah.
I didn't even know what you guys were talking about with the playlist, but now I can start pointing to playlist.
Yeah,
yes.
Now if we have we're trying to.
We have pretty much everything in a playlist now.
Yeah. So
okay, that's cool. I didn't even know we had that.
Yeah, you got one more. So
it's cool, man. Thank you, Nils. So a Fleur-de-Lis is a type of tummy tuck. It's actually the most extreme tummy tuck we do, which takes out excess skin horizontally, right, an incision from hip to hip, but also does an incision in the midline of your abdomen up to your xiphoid process, the lower part of your chest bone, and takes skin out vertically too.
That's what we should insert a picture of here, Nils. And I think we have that from our tummy tuck episode of the different types of tummy tuck, because the Fleur-de-Lis is a very specific type of tummy tuck with a different looking incision that Dr. Martin is describing, but it can be hard to visualize it.
If you want to just put in Fleur-de-Lis, French spelling, into because if you spell it, you're from Kentucky, you say Fleur, F-L-E-R. So it is basically the kind of thing that you see on all the French stuff. It is looks like
think of like a leaf, and you're bringing all the leaves together, like a leaf, or three points on a leaf, and you're bringing all the leaves into one.
Right. So you have a leaf that goes out one side, the other, and vertically, and that's what you bring it together. But you end up with an upside down T scar. Fleur-de-Lis are primarily for people with massive weight loss. Rarely would you do that on a person that hasn't had greater than 40 or 50 pound weight loss, because they just don't have the redundancy that qualifies them for it.
Yeah, you have to have laxity like all the way up to like the top of your ribs.
Right.
Like way up, or to the bottom of your ribs.
And let's just say, for example, you lose 100 pounds. 100 pounds, you have laxity both in the horizontal and vertical planes, everything is loose. So even when you pull down, like you really pull down toward your pubic hair, toward your legs, you still have this vertical laxity in the middle. And that can be really upsetting to do a tummy tuck and you bend over and you still have some laxity.
Or even
there.
standing up. I mean, if you really need a Fleur-de-Lis and you don't, if you truly need a Fleur-de-Lis and you just do a tummy tuck, you're going to have a weird kind of raisiny, rippliness of your whole abdomen after.
Totally.
Yeah.
It's an amazingly transformative procedure, but everything that we do has a cost. And that scar is a visible midline scar that goes straight up your abdomen from your pubic hair to your chest. And a lot of people, that's off-putting, but that's the only option you have. So the Fleur-de-Lis is a specific tummy tuck. You can do a body lift, like a lower body lift and a tummy tuck mixed together. We talked about that in the body lift episode. Mm-hmm. So I think somebody had asked the question that they had an incision that came all the way around, but they didn't do a tummy tuck, which was confusing to me. But sometimes you might not be a candidate for a tummy tuck at the same time for health reasons or whatever. I'm not your doctor, so it's hard to know. But you can definitely do a body lift and tummy tuck together. Mm-hmm. And you could definitely do a body lift, tummy tuck together, and do a Fleur-de-Lis. That's a lot of surgery.
It's a lot of incision.
A lot of healing. Mm-hmm. That's about kind of getting to the extremes for one surgery.
Yeah, but could be done.
Yeah,
It'd be a good way to get rid of a lot of skin at once. So, Mrs. Julie Smith, I hope that was helpful, and I hope the picture was helpful. Because I think this is one, like with the Fleur-de-Lis, you do have to kind of show the picture of where that incision goes, even though you described it very, very well. All right. So this is still part 1. Yep. Everything you know about body lifts, part 1, we had from Lukuma 79. Doctor, could you please make a video about scarring for this procedure? Can the scar become completely invisible with time? Could stem cell injections help? So we answered the first part of this question in our scar episode and in the scar question we just asked. So we talked a lot about scars. So yes, the scar will never be completely invisible, but it can be very imperceptible. But Dr. Martin, the reason I brought this one up was talk about stem cell injections to the scar.
Yeah, well, stem cell, it's my understanding the FDA still has not approved us taking fat out, isolating stem cells and injecting them back in.
Not in this country.
Well, there are earmarked areas where you can do this, people that have IRBs and they're studying these kind of things. But in terms of the open market, it's my understanding the FDA still to this day does not allow you to manipulate these cells in any way and re-inject it. Now, if you take blood out and spin it down and get PRP, that's not manipulation. That's just one component in the blood. And you're injecting that back in, they're okay with that. If you take fat out and inject that back in as a fat transfer, they're okay with that. But if you take that fat, manipulate it down, isolate a stem cell, clone that stem cell,
grow it,
and then re-inject it, that's my understanding, and I know I'm right on this, that the FDA is like, you cannot do that. So,
and would that even help, I think, is the bigger question.
So it's such a good question, and I think the answer is we absolutely don't know because there's not enough data. I think it's not going to help as much as you think because that's not really what I think stem cells would be useful for. I think if we're talking along that line in the future, this is say 30 years down the line, what's a future of plastic surgery? I can't point it out. One of my favorite episodes.
Oh, that's your last point. If you point it, that's your last point.
Future of plastic surgery.
Yep, that's it. You dinged your last ding.
Son of a bitch. Yeah. The future of plastic surgery, we talk about 30 years down the line. Yeah, probably they'll have some compounds that we inject into the scar at the time of surgery or afterwards that manipulate the scar.
Exosomes.
Something like that. But I just don't think it's going to be stem cells per se. Because in reality, the healing process is very, very complex. Mm-hmm. It's almost like I remember when I was coming up that the guy who I was one of my mentors in the trauma department was studying chaos theory because that was really equivalent to the mathematical power it takes to understand wound healing.
Yeah.
That's how complex it is.
That's so true.
And so he was going to mathematical conferences to understand literally physiology related to wound healing and trauma.
Yeah, that your body literally does without you having to think about it.
And it is so complex. Yeah. But there's many different pathways with many different compounds. So it's probably going to be less about stem cells and more about DNA, RNA,
collagen,
proteins, elastin. Some sort of weird technology that probably people get fired up about. And Joe Rogan would hate.
It would be more like, truly, when you think about this, like, what are you really trying to do? You're trying to like regrow your own skin over an area to make it look like there's no scar there. So that to me is more like that they would actually be growing your skin cells, not your stem cells, perhaps. Like actually growing epithelial tissue and somehow grafting it onto the scarred area to make it blend with almost like a skin tattoo.
Oh yeah.
That's kind of what I think. I mean, like
there are people who do research on this. There is real world data. Some fetuses, babies in the womb, still in their mother, they do surgery on them for their heart problems. Okay.
So or for spina bifida.
Yeah.
Yep.
So, and again, I'm not an expert in this, so please do not make comments about how I'm not saying this correctly, but they've noticed with in those situations that the kids could be born without scars.
Yeah, with no scars.
So they clearly understand there's some milieu, chemical milieu, biological milieu in there that is allowing them, and it, my understanding, we don't totally know what's going on. That probably has some stem cell basis or something like that. So yeah, I mean, there's going to be something that comes out, but it's not just going to be re-injecting stem cells. Mm-mm. And even re-injecting stem cells, you're not really injecting it where you need it, which is right on the skin itself.
That's what I mean. Like that's my, could it help? I mean, I think that's the bigger part of this question is like, I mean, it's kind of one of those things, like if you go to a country where this is legal, where they
Mexico,
do this, is it going to hurt?
India.
Probably not.
Turkey.
Is it actually going to help? Your mileage may vary.
Yeah. But if you got the money, you want to spend $30,000.
I was going to say, if you've got the $40,000 to spend on it, go for it.
Go for it. We'll pull the fat out, give it to you, and go take it to Mexico and get it spun down for stem cells. What were you going to say, Neil?
So what you're saying is in the future, after surgery, you'll sleep in a synthetic womb.
Yeah.
Yes.
And regrow your skin.
And then you'll have
There has to be a movie where that happens.
I'm sure there absolutely is. Oh my gosh, any
like
of the movies
Matrix where he comes out of his pod, right?
Yeah, or like Fifth Element.
Yeah, there you go.
Yeah.
All right.
Like, I mean, yes. So Lucuma 79.
Patent pending, by the way.
Yeah. The skin regrowth
We have
pod.
it on video. We have no idea about the technology.
We're going to make the skin regrowth.
We'll take 1%. We'll take 1%.
I mean, in that case, you don't even need the surgery. You just regrow your skin. Like you just regrow tighter skin. Like perfect. You don't need a scar at all. Like that's the future. That's the future of plastic surgery.
I'm going to regrow my personality. So it's going to be all brand new.
That's an ever evolving thing.
Yes.
All right. So then from everything you need to know about thigh lifts part 2, this is from Donna Lee Gibson. Oh my gosh, I actually got that right. Are vibration plates a good tool for healing? So yes, and I did respond to this. And here's the thing with vibration. You want to time it correctly. Now, what I really like after, like in the acute phase after surgery, and we're talking specifically about thigh lifts, right? Thigh lifts are complicated by the fact that you can't really be sitting. So one of the things that I really like after like tummy tucks or other like lipo is gentle rebounding. So even just like sitting on an exercise ball and bouncing, like rebounding is really good for healing. Well, you can't really do that after a thigh lift because you can't be sitting and you definitely don't want to be like bouncing up and down on a ball. So would vibration plates help? Now the scientific data on vibration for healing is very mixed. It's very much your results may vary. Is it going to hurt anything? No, as long as you're cleared by your surgeon and your incision is at least past that initial point of healing. Like I wouldn't feel comfortable with somebody doing a vibration plate like the first week after surgery, just on the off
week
chance.
3 to 4, maybe. Right?
Yeah, and I mean,
is that too early?
By week 2, I kind of think as long as everything's healing really well, I'd be okay with it because you can change the vibration amount, you know. But yeah, absolutely. I mean, there's like tapotement, vibration, like all these things are like very fundamental in how.
I think if you're on those vibration plates, I mean, I've never done one, but I get the idea that you're on there. You have to stabilize your body. You're engaging your muscles. And
well, you can even do them sitting, like which is just your feet on it.
Oh, okay.
Like they're not about muscle. They're really about that vibration. So like, because
the ones I've seen at the gym, people are standing on.
That's different. I mean, you can stand, but that's what I mean. Like you can even sit on these things. Like they're the ones that are not meant for exercise.
It's true, just vibration.
Correct.
Okay, well then that's probably mixed. But yeah, I mean, it's not going to hurt.
It's not going to hurt.
Yeah.
And vibration helps with blood flow. So I mean. And like one of the things I have people do after surgery is tap. Well, what is tapping? I mean, tapping is kind of vibration, right? It's gentle tapotement. Every morning I do tapping on my sternum to help with. Do
you remember Wolf of Wall Street?
What part?
When he's doing that.
Yeah.
When she was tapping.
Yeah.
Yes.
Loud. Yeah. I know it's loud, right? Yeah.
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 Matthew McConaughey.
So there is very good data on vibration, like tapping and for stimulating blood flow, for stimulating collagen production. So do I think that it could be great? I think it could be a net positive for sure, as long as it's cleared by your surgeon and not immediately after surgery.
Yep.
What do you think?
I totally agree. I don't think it's going to hurt. I'm not sure it's going to help, but why not?
Exactly.
Yeah.
Yeah. And I love tapping. And it's, it's not super easy to be tapping on your inner thighs. Yeah. All right. So we've answered all of the questions in part 1.
Is that to note that there's a part 2?
There is a part 2.
Oh no.
I know. When I put these together, I was like, I sent them over. I'm like, this is definitely going to be a 2-parter. There's a lot. So definitely come back in 2 weeks for part 2. Until then, if you do want to look at Dr. Martin's blog articles about facelifts, not Facebooks, facelifts, you can find us on social media at Jason Martin MD and at Beauty and the Surgeon Podcast. And you can always, if you want to be a part of the next episode, leave us a comment, leave us a question, or send me a voicemail, 303-630-9038.
We want to hear from you. We like it.
I know. I love getting voicemails. They're fun.
Yes.
Yeah. And we'll see you all here next time.
All right. See you later.